All right, we're going to go ahead and get started so we're making good use of everybody's time. And I want to welcome Dahlia, if you can go to the next slide, please. All right, as you can see from the agenda that was sent to you, we have two speaking sessions today. One will be focused on our back to school campaign and efforts, as well as just raising some information about our MAC to make sure everybody's aware. And then the second will be with the Virginia Healthcare Foundation and their Project Connect team and their SUN trainings that they do, which is awesome. So, okay. All right. And so next slide, please. All right, that's what we have up, and then we're going to wrap it up with announcements and closing. Next slide. Next slide, please. Well, thank you so much for coming today. Oh, I thought we changed that from the last time, Dahlia. So since we did this question the last time, we'll just skip it in the chat. But if you could go ahead and place your name, your position, your organization, I would greatly appreciate that. And we'll make sure we'll have a fresh question for next go round. But again, thank you so much for joining us today. And please place your name, position, and organization in the chat so that we can get to know who's here today. Next slide, please. All right, so we're going to start with our first presentation, and that's going to be given by myself and Rachel Lawrence. And she is on our team, and she's going to do a demonstration for us today. So let's keep rolling. All right, next slide, please. All right, so go back. All right, next slide. Oh, we're missing a slide there. All right, so our back to school campaign was launched in 2021. And the purpose of the Back to School campaign is to raise awareness about access to Medicaid and FAMAS within our school system, understanding that our school system in of itself have a lot of connecting pieces, right? They have a lot of support systems within that system. And that includes our parents, that includes our guardians, the school staff, as well as you have social workers that exist across oftentimes districts and regions. And then you have different things that we like to provide to those social support systems or coordination of care, if you would like, which comes in the form of promotional materials, whether that be digital or in print. We have had some historical partners that include VDOE, the Virginia Department of Education. And within those, they also look at that network of support that can exist, which is the McKinney Veto, homeless liaisons, school nurses, nutrition program supervisors, like I said before, social workers, PTO, PTA leadership, and then those coordinators that also exist at VDOE in order to ensure that the children who have Medicaid or who are eligible and they can get referred, are networked to the appropriate resource. So traditionally, we have had a back to school flyer, information that has been sent out to superintendents and principals. And to this day, we still have that. The 2023 back to school flyer is up on the website, thanks to the entire team for pulling that together each year in order to make sure you have in our school systems have a resource to share with those parents and guardians, as well as within those care coordinators that exist within the system. It comes in 7 different languages. It's double-sided, and you can also order it. You can also place any widgets on their personal website if they would like. And Rachel is kind of going to go through and look at the demonstration of what that looks like, or where you can find some of those resources on our website in just a few minutes. But we want to make sure that in this season, and this is where this presentation picks up, and we're talking about what we typically send as a suggestion to our superintendents and principals, and placing a link on the school website, distributing through if they have those virtual learning packets, or even if they have something that they send out every couple of weeks or once a month, including that information around the start of the school system, the school year. New student enrollment packets as they get students that come into their systems that may qualify. And then when our parents and guardians engage in those PTO and PTA meetings, making sure that they have that additional resource and information to share at those events or through their networks if they shall. And they don't always have to just stick to the back to school flyer. They can always choose to download or to order additional materials that do some explanation of those services and those benefits, automated call systems, which include robocalls, and we know our parents and guardians get plenty of those, text messagings, and we provide guidance and we provide some scripted information for each one of those things as well, so they don't have to start from scratch. And then distributing social media information, graphics, and copy. And then we've added over time, in addition to all of the social media things, the messaging, the audio, the automated messaging, the scripting, and then making sure that we have those resources in alternate languages as well to ensure that everyone has equal access to it. Next slide, please. Oh, it's out of order. Next slide, please. All right, so a lot of the frequently asked questions that we have, is, like, how can I order these additional flyers? And Rachel is going to demonstrate that and walk you through what that looks like. It's on a Cover Virginia website. And then the quantity actually may have changed, considering this year we've encouraged our school systems to go into the system and order them on their own behalf. And she'll also demonstrate what that looks like. And then we have, is there additional cost for the flyers? It is not. These are free. We encourage all of our school system support staff, as well as parent, guardians, stakeholders, and community partners to still also order that materials and have that available at any event that you may have and be hosting as well. When will the flyers be delivered to the schools? This year, we chose not to do a delivery in a traditional manner and just have our school systems know about it, but also initiate that ordering process. We've gotten some feedback in the past that said, they might want to initiate that rather than automatically receiving. So we thought this year we would go ahead and test that theory. We will also, though, Rachel has noticed that we don't get the large influx of requests that we have traditionally. So we're going to be helping to place orders on behalf of some of our larger school systems just to make sure that they are actually getting that information and passing it along to our young members. When will the schools be handing out this information? It's at the discretion as to when they hand it out. We make it available in late July, early August, and they decide as to what time frame works best for them in order to distribute it. And you can see some strategies that have been used in the past in order for them to do so. And we give them lots of suggestions when trying to get that done. Where can we go to find more information about what type outreach is going to be done? Actually, Rachel is going to answer that question for you today. If you can go to the next slide, please. And she's going to do a demonstration of what that looks like. So Dahlia is going to, and Dahlia is running slides today. Thank you so much, Dahlia. Dahlia is going to bring down this presentation, and then Rachel is going to take over and demonstrate where you can find all of this information on the Cover Virginia website. So I will turn it over to her.
Alrighty, can everybody see my screen? So here is the main back to school page. You can actually find it under the Learn tab up under Insurance for Children. Then you can just go to back to school. And this is the main page that you will go and see all things back to school. It tells you a little bit about the campaign, as Natalie mentioned. You can find the back to school flyer here in all of the languages. And then just a little bit more for parents and guardians, and then resources for schools is down at the bottom. But the main page that you want to go to find the promotional materials is this subpage, and you will also be able to find any of the print materials that we've created. Jonathan, our graphic designer, has done a great job in creating the social media assets, the animations, and other media materials. The messaging is here along with the widget. But the place that you can go to. You can either go to the main back to school page, which I will go back to in order to order the flyer. You'll just click on order online. It brings you to the order materials page. And this is where you'll fill out all of your information. They are free, so you don't need to put any payment information, but it won't, you'll fill out that. Then you will click on the type of material. It'll bring you down to a list, and you'll click on back to school and the amount. If you do need more than 200 of the flyers, you will need to put in the notes section, which will be at the bottom. Just say, I need 500 or I need 1,000, and the reason why. Someone will probably contact you if it's more than 500, and then you can provide that reason if you haven't provided it in the notes section already. But you should be approved and will receive those materials within a week. If it's any longer, please contact us. Usually it's no more than 10 days. If it is around 10 days, that just means that there's been an influx in materials being ordered, such as the beginning of the school year, but otherwise you shouldn't have a problem. And that should be it.
Thank you so much, Rachel.
Sure.
If you
Does
can stop
anybody have any
sharing, and
questions?
Dahlia. Oh, you want to take questions at the very end? And also we'll take
Sure.
questions via chat. That's how we typically take the questions. So if you
Sure,
can
no
drop
problem.
them there, we will make sure to answer all of them at the very end. So that's our back to school. So that's really important for us to make sure that you have that information. And I'm going to pause so that Dahlia can bring back up the other presentation. Wonderful. All right, so you have the information about the back to school campaign. We hope that we get an influx of orders regarding those resources so that we make sure they're equally being distributed throughout the communities regarding how our young members, our parents and guardians in school systems, and our social support members in those school systems can get information out about Virginia Medicaid. The next thing we wanted to plug and just give some information about is our Medicaid Member Advisory Committee. That committee is near and dear to our team's heart, as well as to our agency director's heart and our deputy, is to make sure that we give opportunities for our members to share their lived experience and provide feedback directly to our agency leadership. And what does that look like, and how can we make sure that we're getting appropriate representation of all of the different facets of those who are utilizing Virginia Medicaid. And so if you go to the next slide, please. All right, so you'll see here, I said, this is the purpose, this is what it's there for, experiences, observations, recommendations. Our members, the things that we have to do, they provide a tremendous insight, encouraged to participate in discussions and any work that the committee has done. And oftentimes we'll get requests from other state agencies and organizations needing additional feedback on resources that are developed or processes that they're putting in place, just to make sure that from a member standpoint, they understand the impact of the decisions and the things they're going to be operationalizing. So it is really imperative that we have really wonderful representative members who are not afraid of just diving in and sharing their feedback. They do not need to be an expert on Medicaid. They only need to be an expert on their experience while navigating Virginia Medicaid. And they do not represent any advocacy groups because they're speaking on behalf of themselves and their lived experience. And it may be some that are similar to them, but we definitely create understanding about how they go about doing that advocating if they so choose to do so. Just as I said before, be willing to share your Medicaid observations, share suggestions on how we can improve processes or how it's impacting you as a member. It's normally a one-term appointment, and then you can be extended for another year at the discretion of the agency. Next slide, please. So here's a QR code directly to the application in of itself. I encourage each of you to pull out your phones and pull up the application and share this link with any member that you think would be an asset. We take applications all year round and they're reviewed, and we ensure that there is a diverse group of committee members. I said before, we want to make sure that the perspective that's taken into account when creating opportunities and hearing a lot of the initiatives that are going on within the agency or alongside the agency, we want to make sure that we have those different perspectives and voices sitting at the table so they can provide that feedback. Our logistics is we typically meet four times a year, April, June, August, October. Second Monday of those months, time commitment is from 8 a.m. until 1 p.m. It's in person unless you have received an excused absence, and we do have virtual options if you are unable to attend in person and you have that excused absence. We encourage everyone, even if you're here today and you are yourself a Medicaid recipient, you also qualify to be to apply for the opportunity to serve on this committee. If you also serve, which the vast majority of the people that are here today serve Medicaid recipients, so we really want and hope that you'll be able to pass this information on to them. Next slide, please. All right, and so if you just have any questions about the back to school campaign or any of the information we have shared today regarding our Medicaid member advisory committee, you are welcome to get in contact with our team members. Everyone knows, and they can redirect you as necessary. We encourage you to subscribe to the newsletter. That's the one that you receive before this meeting that has the minutes, but also updates about other things that are going on across the agency or new things that are happening. And then just want to make sure we have a reminder that we provide help for all of our members as far as language access and making sure we have closed captioning. That is, if you needed that today, that link was dropped in the chat. And then just making sure if you have any other questions or needs regarding language services, that you have the contact information for getting that in doing so. Next slide, please. All right, this is where the Cover Virginia website, that is the website that Rachel just demonstrated. And you can go on, find more information, and you can sign up, actually receive text messages and other information regarding a slew of different components of Virginia Medicaid. And just make sure you stay informed about what's happening across the agency, particularly what members get and receive information about as we're going through different phases of the work that happens here at the agency. Next slide, please. All right, this is our social media. I'm sorry, here echo. This is our social media campaign. Our social media platforms. If you want access to that, here's the links for those things. And if you have questions about these platforms or anything like that, please don't hesitate to drop us an email. I'm sorry, I'm getting feedback from. Let me see if I can. It's a phone that okay. So let's go to the next slide, please. All right, this is my contact information, but you also have Cover Virginia or the famous email address that was just shown to you. If you have any questions there, please do not hesitate to send them to us, and we'll be more than happy to answer them. So at this time, let's see if there's any questions for myself or for Rachel. And the slide deck is always provided after the meeting, so we'll make sure you have that. And let's see, the flyer. Yeah, there's a digital copy of the flyer, and that digital copy you can print or you can request to be ordered. So when Rachel demonstrated before, and actually, Rachel, do you want to explain the difference between the two and where to find them one more time?
Sure. So you can find them on the back to school page to either print or order. When you click on each language, it'll bring you to a PDF, and that is the one that you can print. And then the one that you can order, next to all of the languages, there's a order button that says order online, and that will bring you to the page where you can order them.
Okay, perfect. And I want to make sure. Okay. All right, we got both of those questions answered. Well, we have another team up for our next presentation. And if you have more questions for myself or Rachel, we'll be here through the end of the presentation. And if you can just drop them in the chat, we'll be more than happy to answer them for you. If you can go on to the next slide. All right, I'm going to turn it over to Emily and Norma for our next presentation.
Great. Thank you so much, Natalie, and thank you for having us here today. Dahlia, you can head to the next slide, please. Perfect. Well, good morning, everyone. My name is Emily Roller. My colleague Norma Ryan and I are going to share a few words about the Virginia Healthcare Foundation and about our initiatives specific to Medicaid and FAMUS outreach and enrollment. So you can head to the next slide, Dahlia. First things first, want to introduce, for those of you who may not know us, the Virginia Healthcare Foundation is a public-private partnership that was established by Virginia's General Assembly back in 1992. So we've been around for a little over 30 years now. And for about 25 of those 30 years, we have had a hand in raising awareness of and helping Virginians enroll or renew their coverage in the Medicaid and FAMUS programs. Our overall mission as an organization is to increase access to primary health care. And under that kind of umbrella, we do include medical, behavioral health, as well as dental for uninsured or for underserved Virginians, medically underserved Virginians. And we tend to think that one of the best ways to do that is to increase the number of Virginians who are enrolled in these wonderful programs, Medicaid and FAMUS. And we kind of meet that piece of our mission via a two-pronged approach. The first is that we give grants for application assisters throughout the state, known as Project Connect, who actually provide that critical one-to-one assistance with enrolling in or renewing Medicaid or FAMUS coverage. And over the 25 or so years that we have had Project Connect, our teams have collectively helped more than 139,000 Virginians to enroll or renew. And then the other prong of our health insurance initiatives is our training program, which is called Sign Up Now. And during the around 25 or so years that Sign Up Now has been working, we have helped more than 17,000 community helpers. So folks who work for organizations that typically have a vested interest in helping their clients to obtain health insurance. So folks like federally qualified health centers, I know I've seen a few of you all on the line today, schools, as well as Medicaid managed care organizations and everybody in between. We have helped more than 17,000 of those folks kind of have the skills and knowledge base that they need to help folks enroll and renew in these programs as well. And we'll talk more about each one of those things in just a moment. But Dahlia, you can go to the next slide. So we wanted to show you real quick, just in case you are in one of our covered service areas for Project Connect, we've got folks in a couple of pockets throughout the state. As you can see, we have folks here in the Richmond area, as well as up in Northern Virginia. But we also have folks throughout the south side and southwestern portions of the state. And we will equip you after today's time is through with where you can go. You can see the web address here as well to reach out to one of our Project Connect application assisters if you or maybe some of the clients that you serve might be in need of one-to-one help enrolling in or renewing their Medicaid and FAMUS coverage. And you can see up there in the corner, there's a picture of our fabulous team and our fabulous DMAS colleague, Natalie Pennywell, sporting their "A Sisterhood is Powerful" t-shirts. We do believe that one-to-one application assistance is a critical piece of the puzzle for helping Virginians enroll in and renew their Medicaid and FAMUS. And we're grateful to the Department of Medical Assistance Services for their ongoing support of Project Connect. And now I am going to pass the ball to my colleague, Norma Ryan, to give you an overview of the different ways that Project Connect application assisters help folks in their communities. So take it away, Norma. And I think, Dahlia, you can go to the next slide.
Thanks, Emily. Good morning, everyone. And Natalie, thank you for this opportunity. Sorry about the difficulties, the technical difficulties. You have heard about Project Connect and the 21 grantees this initiative has across the state. I am Norma Ryan, and I am one of the 21 grantees. I am in Richmond and work for the Virginia Healthcare Foundation. But what does our job entail? Let's take a look at our main responsibilities. Education about the programs. The goal is for all agencies and representatives and the families and individuals they serve to know about the famous Medicaid programs and understand the basics about the eligibility requirements and ways to apply. So we actively conduct public awareness and outreach and educate individuals and families about the programs. Partnership building. Forming strong connections with community organizations is very vital in our work. To get the referrals from these community organizations helps us identify the eligible Virginians who could benefit from the application assistance for the famous Medicaid programs. We also help individuals and families collect verifications and documents. And this is, of course, to ensure a successful process. So we actively and very diligently assist with submitting all the required verifications to the local Department of Social Services and to the Cover Virginia Central Processing Unit. Additionally, we help individuals and families understand the Medicaid benefits. So once they get enrolled, we put in some extra effort to help them access all the benefits they qualify for. Advocacy on individuals' behalf, that happens every day. Once, of course, they enroll, if we encounter an error in the determination or if the family gets an incorrect denial, we collaborate with the appropriate agencies on behalf of the family to ensure they get the coverage they qualify for. Next slide. Additionally, we have been very, very busy providing one-on-one renewal assistance and helping clients update their information, especially since March of this year when renewals started coming back. We are also doing presentations and community events to spread the word about the renewals coming back. We have disseminated the renewals are coming buttons to keep partners continue spreading the word. And back to Emily.
Great, thank you so much, Norma. And Dahlia, you can head to the next slide. The other piece of our health insurance related initiatives is our Sign Up Now Medicaid and Famous workshops. And at these workshops, we like to teach staff or volunteers from helper organizations. The examples I gave earlier were clinics and schools, but we love to have representatives from Medicaid managed care organizations, as well as community-based nonprofits, and really volunteers, any folks who need to know more about these programs in an effort to help their clients to enroll or renew. We educate folks about the Medicaid and Famous rules, how to apply, and then also what happens after someone gets enrolled, the kind of critical pieces of follow-up and selecting a managed care organization and all of that. We actually offer two different workshops now. One of them is what we call Sign Up Now Medicaid Famous, and that kind of discusses the programs for children, pregnant folks, and non-elderly Virginians, so folks who are under 65 years of age. And then we also have a program, a Sign Up Now training series for Virginians who are aged, blind, or disabled and qualify for Medicaid based on being aged, blind, or disabled. And so we do cover a little bit about long-term care and the Medicare savings programs in that workshop series as well. And we'll distribute information as well about how to sign up for one of our Sign Up Now workshops. They are all virtual, and we now have them scheduled out actually into January. So if you are interested, or if you are maybe have a colleague who might be interested in attending, you can head to our website at vhcf.org/workshops and see all of the available dates and register for a workshop of your choosing. And I believe that concludes things on our end, Dahlia and Natalie. So I will pass the ball back to you.
Well, let's pause for a second and see if our attendees have any questions for you. I didn't see any come through the chat per se. And let me see if any came in the questions. No, none came to the questions. If you have a question, please drop it in the chat and we'll make sure that Norma and Emily are able to answer it. I will ask, during this very busy time, Emily and Norma, there's so much to be done. There's so much work to be done. How are each of the Project Connect workers balancing between the events that they have to do and working individually with the members who actually need the guidance as they're working through this process? What does that look like and how is that balance taking place for them? Because the work is abundant.
Absolutely, and I'm happy to kind of kick things off. And Norma, please feel free to add to what I share. I think one thing that our Project Connect outreach workers are very conscious of is attending events at which they anticipate they will come across folks who maybe need their help. Community events, especially this time of year, there's so many. And so we kind of have some criteria around what kind of tends to be the most effective outreach events that you anticipate you'll come across a good number of folks, but also exactly like you said, Natalie, keep that delicate balance in place. Most also actually will go on site to certain organizations throughout the week where they receive large numbers of referrals historically. And so many of our Project Connect partners work with their local Head Starts, local, federally qualified health centers or free and hybrid clinics, as well as, key partners like food banks that work in the community. And so they aim to kind of maybe merge the two ideas of an outreach event as well as the on-site application assistance by meeting people where they are. And I think that's a critical piece of successful application assistance. And I know Norma, for instance, in the Richmond area goes to a couple of community-based nonprofits and even a city office. So I don't know if Norma, you might want to share about what those locations are for you, if that might be helpful to hear too.
The communication is a little broken. Emily, if you can repeat the question, please.
Yeah, no problem. I was just going to see if you could share the different community locations that you work out of each week, just so that folks can hear the types of organizations where they might come across a Medicaid or famous outreach worker from.
For example, today I am at the Office of Immigrants and Refugees, which is housed at the Southside Plaza, where Social Services of Richmond is. And of course, they're only seeing people by appointment, but the flow tends to be consistent, and I'm getting a very good number of referrals from the security guards that bringing people to where I am to be assisted. And I also go to Crossover Clinic on Fridays, where I call it my busiest day because I really rarely have time for anything else, but because I am seeing clients, back to back at the Crossover Clinic all day long on Friday. I also go to Waymakers. At Waymakers, people come to get a variety of resources, but mainly it's a food bank. And so they are well known. And although I am scheduling appointments for this location in advance, it's also a very busy location. I'm also answering a lot of questions, especially about renewals. And so a little bit about how we balance our time. We are very aware that this is the time to prioritize the renewal, the massive amount of people requesting assistance about the renewal. So we really screen for the productivity of every potential event and make sure to ask many questions in advance to the coordinators. So if Emily and I determine that it's worth the time, then I attend the event. Otherwise, we continue doing the application and the renewal one-on-one assistance. Thank you.
That's excellent. So if you have partners who, because we often get this question, I have to end up throwing it back at Emily. If we have community stakeholders who are interested in hosting or having a Project Connect worker come to their site for a day or a period of time, is that a possibility? And if it's not, what would be the appropriate alternative to that request?
Always happy to chat with folks about how that could work best based on the volume that they anticipate and the eligibility criteria maybe that are in place already to have somebody be served by that organization. We have, I would say, for our Project Connect team members, we kind of just depending upon the volume that's anticipated from a community referral partner. There are some places where our folks go once a week, some places where they go twice a week, and some places where they only go once a month. And we collaborate with that partner to kind of set up the schedule based on the partner's needs. So I think the first step to answer your question, Natalie, is I'd be glad to connect with folks who are on the call today about maybe setting that up and what it might look like. I will note, as you probably noticed from the map, we are not in all corners of the state. But we have very good relationships too with our friends over at Enroll Virginia, Boat People SOS, and I know some federally qualified health centers have certified application counselors on staff that do very similar work. And so we kind of continuously collaborate with those teams to make sure that if a partner would like to have application assistance on site, that someone somewhere is able to provide it.
That is always excellent to hear. Okay, so we did get, could you or Norma, well, not Norma probably, but you drop the information for how to connect with you regarding those requests in the chat. And we'll also send that out when we send out the booklets and any additional information regarding this presentation. So that would be wonderful. So they can definitely do that. The other thing is Rachel, and I think Rachel can answer this question best. If community stakeholders or partners are interested in ordering other things outside of the back to school materials, what other materials would you suggest accompanying that particular piece of material?
Usually when you order the back to school flyer, a lot of people tend to order the famous flyer as well, along with the new coverage for adult flyer. And that has actually been revamped as of August. And so it has some new information that's a little more updated than the older adult flyer. We no longer have the brochures. They weren't being ordered as much and weren't being utilized as much, but the two flyers, the famous flyer and the adult flyer, are a little more comprehensive. It's a better summary and it's easier to read. So I'd recommend ordering both the famous flyer and the adult flyer.
Excellent. All right, those were all of the questions that we have. Any parting words from either of our speakers? I know for me, I encourage people to please refer the Medicaid MAC as an ongoing resource for those to be considered. And then also please order the 2023 back to school flyers. We would love to see them in every corner at every event across the state. Any closing remarks or words from Norma or Emily? Oh, hearing none. Oh, Emily.
Not much here, just a thank you for having us today, Natalie. And folks, please do feel free to contact us if you're interested in having an application assister to refer your clients to. I'll put the contact information in the chat.
Thank you so much. All right, and then if you can go to, thanks, Norma. If you can go to the next slide, please, Dahlia. All right, so our next meeting, and I think is it on the next slide, Dahlia, where it states the next meeting? No, okay. Our next meeting is December 7th, and it is a different cadence than normal because our third Thursday actually falls the week of of Christmas. And I know none of us want to be here meeting for that particular week. Hopefully you'll be going to or near family. And so we've moved it up to I think it's the first week, December 7th. So we will be scheduling our last meeting of the year for the community stakeholders at that time. If you have any questions, don't hesitate to let us know, and we will follow up with everyone with the slides and any additional materials that were brought forth today. Thank you so much. We'll give you a little over 15 minutes. Well, I think it's 17 minutes back on your day. Have an excellent day, everyone. Thank you for joining us.